Hi, I'm Dr. DeFabio, and we're going to continue our discussion on the #1 killer in America, cardiovascular disease. We talked a little bit about what you can do to manage blood pressure on one of the other videos, and we also talked about cholesterol. What's your number, and is it really important, and some lifestyle things you can do about that. But we do know there's one thing that you can do that's going to reduce your risk for cardiovascular disease up to 8 times, all right? And that's exercise on a consistent basis. And it doesn't have to be high intensity, but it has to be on a consistent basis. What does that mean? It means cardio. It means walking. It means cycling. It means swimming. It means running. It doesn't have to be hard, elliptical, something, cardiovascular exercise. How much? A minimum of 120 minutes a week. In fact, the Cleveland Clinic recommends for brain health 150 minutes a week, all right, of cardio. So for your heart, 120 minutes a week, all right? And what level of intensity? Well, if you're just getting started out, of course, make it light. If you've been exercising a little bit longer, the next rule of thumb is conversational pace. So you can talk like this while you're walking or on the elliptical or on the bike, conversational pace. If you want to get it dialed in a little bit more, there's different heart rate formulas which are good for people, and you want to be in what's called your maximum heart rate range of 70 to 80, 85%. How do you figure that number out? Take your age and take 220 if you're a male and minus your age, and that's your maximum heart rate. Take 226 and minus your age, and that's your maximum heart rate for females. Now, take that maximum heart rate number, times it by 0.7, and then that's your baseline for the minimum heart rate, and times it by 0.8, and that's your maximum. You want to be in that zone for cardiorespiratory fitness. Can you go up to 90% of your maximum heart rate? That's fine, but not every workout. That's a hard workout. Keep it 80% plus or minus a little bit, all right? And that calculation is good for 85% of the people if you exercise a lot. If you're in the gym a bunch, if you're doing a lot of cardio, you're very active, if you're called chronically fit, that calculation may not work for you. You're going to be on the lower end. You're going to have to ramp it up a little bit. You can always go see your cardiologist and get a stress test. He can dial in your maximum heart rate to exactly where it's supposed to be and really get those numbers for you. The bottom line is you don't have to be a statistic of heart disease. The best thing you can do is get consistent cardiovascular activity. Your other lifestyle choices are, of course, to stop smoking if you're a smoker. Smoking increases your risk of any cancer 8 times, and it will cause hardening of the arteries. So just stop smoking if you're a smoker, all right? And then good, healthy lifestyle choices. A Mediterranean anti-inflammatory diet is the way to go. So basic tips on reducing your risk for cardiovascular disease, the #1 killer in America. I'm Dr. DeFabio. This is really important information to share. So let your family members, friends know how they can prevent heart disease for themselves and their loved ones. Please like and share this video. It could save someone's life. Have a great day.